Regulated Industries Committee to order. Got a pretty aggressive agenda today. I don't know how complicated these are going to be. I'm hoping not too bad, but there's only one way to find out. I'll start with folks in your folder. They're all in order. For us, we're going to go in order. House Bill 314, Representative LaHood, if you will take the podium there or the mic, whichever you're more comfortable with. That'll be fine.
Thank you, Mr. Chairman.
All righty. This is about the athletic trainers.
Yes, sir. This bill is about athletic trainers, and what it does, so the Athletic Trainer Practice Act first passed in 1977, and there were some updates to it in 2008, and now the athletic trainers are asking for further updates to align the language in the law with what's actually happening in real life. And the meat of the bill is on, I believe it's line 12, where the word injury is struck and replaced with the word condition. But the condition is qualified by, because the language today reads as if the athletic trainer's scope is limited to injuries that occurred due to an athletic activity. Well, in real life, they're not limited to that today. Athletic trainers are seeing patients who have injuries and or conditions that resulted in other activity, other physical activity, but not necessarily on a sports field or in a sports arena. And so the language in this bill just aligns language and code with what's actually happening in real life. And again, the Practice Act first came into being in 1977, has been updated, I believe, only once in 2008. And there's letters of support for this bill. I think they're in your packet. At least 3 letters of support from the Board of Certification for Athletic Trainers, the National Board, National Athletic Trainers Association, and the Georgia's Professional Licensing Board.
Okay.
I'm sure some of you have received some emails or calls from other professions, physical therapists mainly, but I believe what their argument is basically unfounded, because athletic trainers are already doing the very thing that we're trying to get language to align with now. This is just clarifying. I'll take any questions if there are any.
Okay. So I guess I might as well go ahead and give my little expose before we get going here. We are very heavily inundated with licensing bills in this committee. And that makes sense, since we regulate industries, and that's one way we do it is through licensing. And I am confronted with conflicting notions of what we ought to be doing here. There was a study committee, Senate study committee, that met over the summer, and their recommendations are that we ought to pare down the number of licenses, that they're anti-competitive and they're government red tape, and we need to be carefully looking at the licensing any further professions. Is that a sort of a barrier to entry in certain fields when we're trying to do things? My just offhand review of most of these is, even though many of our licenses started as an attempt to protect the public and to guarantee them that the people providing whatever treatment or services, et cetera, were qualified to do that, in many cases they end up being barriers to competition and limiting the number of people that can offer those very same services that we're regulating. And I'm noticing an awful lot of scope of practice type disputes that are now being fought out in this committee instead of the health committee or somewhere else. And I'm discovering as I dig into a lot of these bills that the true motivation on many of them is financial motivation of the industry, profession, trade, whatever it is that we're licensing, because of certain, particularly federal requirements as to reimbursement for services that are tied sometimes to being licensed in that area. So I've got all these different sort of competing notions swirling around in my head, but our default position is kind of, we're sick of licensing everybody from, a painter to somebody that washes your hair, which we're seeing things like that in here. So I don't mean that as aggressively as that just sounded, but I need to be sold as to why we need to license all these new people. The other thing we're seeing, I see Representative Silcox here, is a lot of compacts all of a sudden. And all that is super licensing, that we are ceding control as a state to a national organization or some series of states. And is that smart for us to defer to qualifications to a non-Georgia entity that we don't control? The most persuasive argument for it that I'm seeing comes from the Department of Defense, which has sent us letters saying for military spouses, they get transferred so frequently, even though they only maybe get stationed here a couple of years, it is a barrier for them to be employed if they're in a licensed profession. I find it hard to believe that the majority of military spouses are in licensed professions, but the more I look around here, we got a whole bunch of those. So maybe they are, we'll see. But that is a reason, and some of the times the different trades and professions say that would make it a lot easier. And the final thing is superimposed on all of this is, I bet I can speak for everybody on this committee, the most complaints of any type we get as legislatures are people complaining about their difficulty getting licenses renewed or issued or whatever. And so, man, I'm hesitant to keep building more licenses where just got a new group of people going to be complaining about them not getting renewed or whatever. So everybody think about all that as we review these bills. And I'm not saying anything critical about your bill, Representative, because let me make clear, we already license athletic trainers, right? You're not creating a new license here. You're perfecting or revising what we already have.
Correct. We're just bringing clarity.
So distill that for me just a little bit more. What's the murky part that you are crystally clear making after this change?
All right. So thank you for all that context.
Yeah, I'm
I think
sorry
it's
for the
very
speech,
relevant.
but I want us to be focused on what we're doing.
Yes, I think that's great context. If you look on page 1, lines 12 through 16, the end of that page, striking the word injury and replacing with condition, but leaving the qualifier that the condition must be a result of, on line 14, activities requiring physical strength, agility, flexibility, range of motion, speed, or stamina, without respect to where the condition occurred. Does not expand scope. It's just clarifying. And I'll give a couple of examples. When you think of an athletic injury, you think of a sprained ankle or an orthopedic type injury. But there's lots of conditions that can result from your participation in athletics, such as heat exhaustion or staph infection. And athletic trainers are trained in this. It's in their curriculum. Okay. And so they're just simply asking for clarification in the law so that their practice and ability to help, I would even argue that their audience would probably remain mostly athletes. But you can twist your knee walking up the stairs at home or walking across the grocery store parking lot. And the treatment is the same, whether it happened there or on a baseball field. Okay. And so another point I'd like to make is a lot of physical therapy clinics are hiring athletic trainers, to work in their clinics to supplement what they're doing. And
So before you leave that point, right now, an athletic trainer can treat a sports injury, basically. And you're broadening that to a condition that is related to physical activity, basically. You're broadening the scope in the definition, even though you say as a practical matter, it's happening anyway.
Right.
Okay.
I wouldn't say we're broadening it, we're clarifying, because they're already doing it today. And I believe I have an expert here that signed up to speak,
All right.
and he can explain that. I believe it was 2008, some legislation passed that allowed more than athletic injuries to be treated, and it's been happening now since then.
Okay.
And so if they were going to take over the world and put physical therapists out of business, it would have already happened.
Okay.
So
What else does the bill do that's changing current law?
good question. And that is the meat of the bill, changing that
Okay.
word, injury to condition.
right. There was some stuff about certification, or, what, I didn't comprehend exactly what the difference was in
Yeah,
certifying a person.
I believe that's just bringing the certification criteria under the National Athletic Trainers Board, what they recognize as, and just making it consistent with
Okay.
what's happening around the country. And I do want to point out that two of our border states, I believe it's Florida and Alabama, are already have the word condition in the
Okay.
athletic trainer scope. So this is not something new. Again, it's just bringing the language in line with what's happening.
So where I caught change to was page 3 down there, line 62 to 64. Right now, you have to get this license for an athletic trainer, you have to have met the athletic training curriculum requirements of a college or university that's approved by the board. And you're changing it to you can just be a graduate of an accredited educational program that prepares the athletic trainers. What's the difference? Are you just rewording the same thing, or are you adding a requirement, narrowing the kind of institutions you can attend or required to? Because it goes on to say, or equivalent educational credentials approved by the board, which makes me think maybe you don't even have to graduate from an accredited program if the board says you don't. Are you got a problem with these folks that are going to online schools or fly-by-night institutions, or something that you're trying to capture, or make sure you get some more qualified people?
If it's okay with you, I'd like my expert to
All right.
explain that.
Fair enough.
He's on staff at VSU in my district.
Okay. Now, I've heard
and,
great things about their program.
It's a great program, and a lot of good things happening there. I've visited the site several times and seen people that go and use it. And these are people who are just trying to get back in the game of whether it's a sport or just life. I've seen people of various ages in that clinic, and they're being treated by athletic trainers.
Okay. Senator Albers, you're recognized for a question.
Thank you, Mr. Chairman. Representative LaHood, great to see you, and thank you for bringing this forward. So I want to make sure I get my context. So I used to play baseball. So an injury for me is I pulled my hamstring. A condition is I threw my arm out, and they just helped me with some heat and some cool to kind of nurse me back. So I think I'm tracking what you're saying there, but I guess when you said, well, they could treat people outside of athletic injuries, but when I look at what Chairman Cowser was just talking about, an accredited educational program that prepares athletic trainers, I would see that those injuries could be uniquely different, from what I did when I played sports versus someone who maybe fell down their stairs at home. To me, it would be probably apples and oranges. And I guess maybe this is where some of us have been getting some calls from, whether it be PTs or even the regular medical industry, saying, well, wait a minute, let's not go too far. So help me understand where those are not lining up in my mind.
Right. So I'll say a couple things. Appreciate the remarks. First, the referring physician has to bless, the athletic trainer treating this patient.
Okay.
And so there's that, which is very important to note, that the physician's still going to be the gatekeeper on what patient the athletic trainer is treating. And if the athletic trainer, I've got on paper here, some points on what they're trained to do in their education, and there's just a wide variety of injuries and conditions that they're trained to treat. Respiratory conditions is one. There's a list a myriad of conditions that they're trained to treat. And but from the athletic trainers I've been talking to and hearing from, they're not seeking to just open up the door, to just whatever patient in any condition.
So if I
There-
could, Mr. Chairman, could I have
Go
a
right ahead.
follow-up? So if I hear what you're saying, then you're saying the doctor is basically going to prescribe, right? And if the injury is prescribed to an athletic trainer because that fits what they need versus a physical therapist versus they're going to an orthopedic surgeon, right? Each one of those is going to be referable to what the doctor said is the right outcome for that patient. Is that what I'm hearing you say?
Yes.
Okay, thank you. I appreciate it.
And I don't think Representative Silcox would mind me sharing that her husband's an orthopedic, surgeon, and he employs athletic trainers to treat patients.
Okay.
So, there's we just don't, we're trying to bring clarity because there seems to be some confusion now. And so changing the word from injury to condition, we think brings the needed clarity. And it protects the public, consumers, from bad actors. That's another thing this bill does, from bad actors posing as athletic trainers.
Chairman Dolezal, you're recognized for a question.
Thank you, Chairman. Chairman, thank you for being here. Got two questions, if that's okay. The first one's on Section 3 of the bill. I've tried to parse my way through this. I think what I understand is under current law, volunteers or student trainers or assistant trainers essentially can provide a service as a trainer at a competition or elsewhere, as long as they're not paid and as long as there's the supervision of a physician or licensed athletic trainer. You're changing this to essentially they need to be enrolled in school, and so in other words, make it a little more restrictive there, but also that the person who they're under the supervision of on lines 52 to 56, you basically say they have to be present. And I'm curious what the problem is that we're solving there with requiring their physical presence at the facility to oversee these volunteer people.
Yep. Appreciate that, bringing that up. And again, I'd like to defer to the expert that's here that lives this every day, if you don't mind.
Do you do that now? Or
You-
you want me to ask the
They're
second
going to
question?
be next up.
Okay. Second question I had, can you just walk us through what we're doing on lines 72 through 74? It looks like essentially this law, whoever wrote it, they were grandfathering people in. Are those people now going to be required to go back to school to graduate? Why are we striking that grandfathering portion of that?
Yep. Another good question that I'd like to defer to the
Okay,
expert
that's
to
fine.
answer, if you don't mind.
All right, we have 4 people signed up to speak, and I'm going to call you just in the order you were listed here. I mean, whoever, first come, first served, okay? And if you will use the podium, Mr. Paul Higgs. Is this who you were talking about, your expert?
Yep.
That's what I thought.
I'll try.
Tell us who you are and who you work for or represent, what's your skin in the game.
My name is Paul Higgs, and thank you for this chance to answer some of your questions. There's been a lot of interest in this area. I'm Paul Higgs. I'm a licensed athletic trainer. My day job, I work at Valdosta State University as an athletic trainer. I am the director of an outpatient rehabilitation clinic there. I see people from the community of all types. Not here representing them, but as an athletic trainer myself. This wording in the bill came from the Georgia Board of Athletic Trainers. They identified problematic areas in the current Practice Act that made it hard for them to regulate the profession, not to eliminate the people that should be there, but to eliminate the people who should not be there. And they came to us and said, these are the areas we'd like to address. And so together we formed this wording that's in the bill. In every area of the current practice they're addressed, we worked on that wording. And if I can go back to your questions, you may have to remind me which lines you're talking about. The last one, I remember, line 74, we were eliminating those grandfathered people because honestly, there are no more of them left. It's far enough out, they've all retired, they're no longer in the profession. There's honestly nobody left to grandfather in. So the board said that's really irrelevant, we don't need that anymore. If somebody came up from 50 years ago and said, I graduated, I'd like to be an athletic trainer, maybe we'll talk about it, but they're not around anymore. They
So
just
that
aren't
was
there.
20 years ago. It grandfathers in people that
Well, this was
Before 2004, is that when we first started licensing athletic trainers?
1977. Georgia was the second state in the country to have licensure for athletic trainers.
Okay. Wow.
We've done a pretty good run. The last major update in 2008, this may address the next question, that was where lines early in the section, I believe lines 13 through 16, they basically said we could treat injuries regardless of where or how the injury occurs. And that's where you started having athletic trainers that were working beyond organized formal sports. So we have athletic trainers at Moody Air Force Base and Fort Benning who treat the soldiers and airmen there. We have athletic trainers at Tyson Foods in Camilla, Georgia. We have athletic trainers embedded in the police force in Statesboro or Port or Savannah, any of these areas where active populations are involved and can be injured. Some of these injuries, though, are conditions. You don't know when it started. A sickle cell crisis. We can't cure that, but we can monitor those people, prevent it, keep things from escalating, and if it does, we can treat it until we can hand off to the next level of care. A staph infection could occur in the Army barracks as easily as the baseball dugout. That's a condition we treat. We overlap with a lot of fields on the rehab side, or about 20% of what we do, but 80% of what we do is probably outside the rehab field. And that's where a lot of these conditions are seen, and we just want to clarify what we already do, what we're trained in our curriculum standards to do, and have been trained for decades, for the public to understand it's more than just a traumatic accident, falling and spraining your ankle as you cross the street. It could be those conditions that we don't quite know when it started, but it limits me from doing other physical activities. And our opponents will say we want to treat Parkinson's and stroke and spina bifida and obesity. Those are not conditions that result from participation in physical activity. They are conditions, and we limit the wording in the bill to say we only treat conditions that result from physical activity, which I'm paraphrasing as those activities that require strength, range of motion, those things. So it is very broad, but it still is something that only can result from participation in physical activity, and that could be the soldier, that could be the professional, the Atlanta Ballet, that could be the line worker at Tyson, it could be the soldier at Fort Benning, it could be your starting baseball pitcher.
So it's not a car wreck victim?
Potentially. I mean, I've treated
Physical
those.
activity?
That's
Well, if you're a
driving
race
would
driver,
require
I
those
guess.
things. I have treated car accidents, and it all goes through the physician. If they say, as you said, if the physician feels we are the best person to treat that patient at that time, they will refer it to us. So to say that this bill would cause lots of problems, we've had most of this in place since 2008, and there have not been issues. If we were going to change things and be dangerous to the society, it would have happened by 2008. And I've treated multiple things. And there are times physicians call and say, we need to see this patient. I say, that's not something I can treat. That's what professionals do, and I'll be glad to help you find the correct person.
What kind of training or education is required to be licensed as a physical therapist?
Physical therapist.
I'm sorry, athletic trainer.
Athletic training currently is a master's degree
So you have to go 4 years of college and at least
in
1 year.
something, and then go additional training. Right now, it's usually about 2 years. It's a master's degree. That has moved up in the past, just like all the other fields are moving up in degrees. But currently, it's a master's degree.
So the clinical training this bill is referencing under the direct supervision on the premises of another physical therapist or doctor, that is the clinical training to complete your
Right,
master's
and
degree.
thank you for that reminder. We talk about students. Right now, as it stands, anybody could be a student, and it didn't really say what kind of student you had to be. Is this a high school student? Is this an art major? Is this a what? Who just wants to help out and be nice? And we're not talking Good Samaritan by any means. We want to encourage that. We're talking about people working in a school setting making healthcare decisions that really have no formal training in it. So we say if you're going to be a student, getting your hours, an internship, kind of a residency idea, that we want to do that. But if you're going to say you're a student in athletic training, you need to be part of a curriculum program, and you need to be supervised. And that supervision should just be more than I've got my doctor's cell phone number I can call if things get bad. It needs to be somebody standing there who can intervene and prevent me from doing the wrong things or not doing the right things.
Okay.
So we define student and then define the supervision that student is required to have on the sidelines.
How many colleges or universities in Georgia offer this program?
Currently, I believe there are 5 or 6.
Okay.
University of Georgia is one. Valdosta State dropped theirs. Albany State has just added theirs. Georgia Southern has one. North Georgia University, Georgia College, State University where I was before. Several good programs.
Senator Dolezal has a question for you, if you remember it.
I do. It's about what you were just talking about.
Yes, sir.
So remind me again how long these programs are?
The education program, the
Yes.
curriculum, master's degree.
Okay,
So
so I'm in
generally
my-
2 years, a little
In my
more maybe.
second year, my last semester, I'm working with the basketball team as a student trainer.
It could be.
Why are we changing the law to require, I guess, a licensed athletic trainer to be on site when
For
they
that
haven't
student?
had to be since 1977?
We think that's a weakness. They should have been better supervised. If you have students who have not finished a curriculum, they are in no means capable or able to make those kinds of decisions. And we think
And so there could be 3 weeks from graduation, but they're in no way capable of making those decisions.
not completely independently. They haven't passed boards along the way to prove proficiency, to be unleashed like a medical resident might or something. And most programs have a limitation on what their students can do independently. Usually there's somebody around who can intervene, a preceptor, a coordinator, a manager of some type who says, yes, you can go do that and I'm going to watch from a distance versus, no, I'm going to do this and you watch me this time and the next one you do it. So there needs to be supervision. And, going back to your area about secondary schools, right now there's a loophole. People that work in secondary schools, if they're functioning as an athletic trainer, may not require a license depending on how it's done. And we think anybody making a health care decision should have a formal training in some form. Honestly, bus drivers are required to have a greater degree of competency, proven competency to do their jobs than somebody claiming to be an athletic trainer. And nothing against them. We think they should have a high level of competency and proven skill. But if I just say I'm going to be an athletic trainer and make healthcare decisions, that's kind of dangerous. We want to make sure whatever decisions they're making, they have the training to do it. And if I could bring up one thing, does that answer your question, sir? Before I don't want to leave that unanswered.
Sure, yeah.
Yeah, we just think there should be a level of supervision there for anybody claiming to do our job and do our things. We're happy to do that. We don't want to deny a Good Samaritan. We don't deny any other field. Occupational therapy, physical therapy that work in the school systems. They have to have a license and proven competency to do their jobs. We're saying we should be in the same place.
I think functionally, you're getting rid of kind of what we would all think of as a student trainer or an athletic trainer who does provide a service without having to drag one of their supervisors. I can get on board with your changes up to line 52. 52 is where it seems to be a little bit.
Okay. Let's see what 52 is.
Just the requirement of the supervising athletic trainer that must be physically present in the facility. I think it just, in my mind, it fundamentally changes what has been.
Is that different than other fields, how they supervise their students?
I don't.
Correct me if I'm wrong.
Perhaps it is, or perhaps
I
it isn't.
know
just
with
that it-
nursing, physical therapy, a lot of times they are allowed to do some things not remotely as in virtually, but like go in that room, see that patient, I'm going to follow in behind you, but they're still physically present.
Well, let me ask you this question.
Okay.
In the 50 years that y'all have been doing this, is there a period where this direct supervision was required and we took it away, or is this a new?
This would be new.
Addition.
This is actually defining that supervision. And the board says the majority of their complaints about unlicensed practice come from the secondary school setting. Someone acting as an athletic trainer who doesn't have a license, and they say this limits our ability to require a license because of this loophole. And we think that sure should be regulated. If I can throw out one thing before the next question. This body in 2016, the Senate, approved Senate Resolution 992, which was a bill that commended the Georgia Athletic Trainer Association for what we do, but also defined athletic training as the practice encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, subacute, and chronic neuromusculoskeletal and certain medical conditions to minimize subsequent impairments, functional limitations, disability, and societal limitations. We've already been defined as a profession that treats certain medical conditions, and that's all this bill would do, is to formally state that and define, to say we're treating conditions related to participation in physical activity. Those things that are not related to physical activity, Parkinson's, spina bifida, obesity, all those things that we've been threatened that we're taking, we were not going to do that because it's not related to physical activity, one. Two, it would not be referred by our physicians. And to say this would cause problems is saying we have no faith in our physicians. And I don't think that's the case.
Senator Brass, you're recognized for
Yes,
a
sir.
question, and then Senator Summers will be next.
Thank you, Mr. Chairman and Mr. Higgs. I kind of lived in the training room of my high school as I had multiple injuries throughout. My athletic trainer was more like a homeroom teacher for me. But my
fire.
question, so if I were to have a dislocated shoulder, sprained ankle, pulled a hamstring, pulled a groin, and I'm just naming the first four things that came to mind from that did happen to me, would y'all, under current law, you're allowed to treat
Yes, sir.
those and,
Yes.
and help me get better?
I have treated most of those things
Because
myself.
you did. With the except the dislocated shoulder, he got me stabilized and then physically drove me to the urgent care to get the rest of it taken care of. Now, I guess my next question, would, if, let's say on any of these injuries, if I were to say dislocate my shoulder walking up the steps at my house versus them happening on a football field, would the treatment be different?
Largely not. It would be generally the same. Now, age might matter. Your goals to return to whatever activity you're saying you want, it might differ a little bit. The plan might differ a little bit in how we treat it beyond that first few minutes.
What
But
about
the muscles are the
what
same
about
for
a
you.
pulled hamstring, pulled groin? Same. I mean, is it
Generally the
treated
same.
differently?
Generally the same. For somebody who worked in the yard and had this injury versus somebody on the pitcher's mound that had this injury.
Right. So you're already
Largely.
allowed. I
We're already
guess
doing that.
The question is, you're
Yes.
already allowed to do it,
Yes.
right?
Yeah,
It's just
it-
a matter of
And
if I'm in my yard or if I'm
Right.
on a football field.
I mean, Fort Benning, there are soldiers who strain their hamstring every week, I'm sure,
Mm-hmm.
and there are athletic trainers who take care of them. And I seriously doubt they would call that a recreational activity.
Okay. Thank you.
Senator Summers, you're recognized for a question.
Please bear with me on this, because I got to ask those, make it simple for me to understand it, okay?
I'm with you.
I hope you are. All right.
I got to
If
keep
you're
it.
already doing it, why do you need to change?
Good question.
Number one, okay, and I got one A, and I said
Okay,
one A, and I
okay.
got one B to go with.
One more, okay.
Why are the PTs so against it? Okay,
You're about to hear that next.
Oh, yeah, that's coming, I'm sure. So one, why does it need to change?
if you're already doing it.
If we're already doing it. I think the fact that we're having all these arguments and complaints and misunderstanding and turf battles is because it's not really clear. As Mr. LaHood said, we want to clarify what's there, what's in our curriculum standards, and what we're already doing in the field, what our Board of Athletic Training says, they interpret it, but for the public, our employers, our physicians, our patients, our peer professions to say, oh, that's what you do. We understand now. Conditions make sense. You're not just treating musculoskeletal sprained ankles and rotator cuffs. It's all those other things too that are involved in physical activity. That clarifies it for everybody. And for the patient who says, I've got this thing, I know I can see A or B. I think A is better for me this time. And they ask their physician, and the physician says, yeah, I agree, A is the best person to send you to. Let's go to A, whoever A is. But they have a better understanding of us and all the others. And we all overlap because we all treat humans, so there's going to be some overlap. So it just clarifies what we can do without expanding the practice. That was A. What was B?
You're close. I mean,
Okay.
Yeah.
Yeah.
B, well,
B was why the,
right, the PTs.
why the therapist opposed. We
I
got Dr. Kathleen.
I don't know.
Geist
I'm sure
coming
they'll
up.
explain it.
Probably got ahead of
Yeah,
it.
I think they feel conditions is too broad, and if you stop at the fifth word in the sentence, conditions, that means one thing. If you read the whole sentence, it means something else. And I'm asking you to read the whole sentence, that it's conditions related to physical activity, regardless of where or how the condition occurs.
Any
Which
other-
you've been doing it since 2008, right?
Yes. In parts of this, we've been treating this in the athletic organized sports realm since 1977. In 2008, it clarified that we could also treat people outside of formal sports. So we moved into the military arena, performing arts, industry. Hartsfield-Jackson Airport has a lot of athletic trainers working now. The bases all around the state do. Augusta SWAT team had an athletic trainer for a while. I mean, we're everywhere. And
Was it-
nobody's...
Was there any legal actions that brought this upon you guys at Valdosta State? Anybody, insurance, legal, et cetera?
No, I would say the majority of athletic trainers don't file insurance claims. So I appreciate your information that is this a money grab, and for some people it might be, but we all need, there's nothing wrong with trying to pay to keep the lights on. Most athletic trainers aren't filing claims but we want the understanding from our patient populations that, oh, this is the right person to take care of my child, my mom, my brother, me, whatever. And other times it may be somebody else, but for this time we understand what you do and this is the appropriate thing. And if we happen to file an insurance claim, great. My personal USG, I'm an employee of the USG, my insurance covers athletic training services by name. And the other state health employee plans that are Blue Cross Blue Shield, possibly even the ones that cover you, cover athletic training services and have covered them. They don't limit the age of the patient. They don't limit the setting where the condition occurs. It just says if you're working within your scope and it's referred by a physician, it's a covered service.
You're saying we're grandfathered in, right? Just checking.
It's been that way for over a decade that I know of as an employee in the USG. I know my plan has covered my services and I can treat my coworkers and it would be covered. I don't know what your personal plans are. I know there's an option for Blue Cross Blue Shield Anthem. Check into it.
Are approved charges different for an athletic trainer versus a physical therapist?
Generally not. As I understand it, the service is paid at a certain amount. Now, different services can be done by certain professions and not others. But, then that gets deep in the weeds of the coding thing. But generally, we pay this for this service if it's by a qualified individual.
Okay. Any further questions from the committee? All right, let's hear the counterpoint. Dr. Kathleen Geist, Physical Therapy Association. I pronounce that right? Yes. Okay, come on up. Introduce yourself, tell us who you're with, and share your thoughts on the bill.
Good afternoon. Thank you, Mr. Chairman and members of the committee. My name is Dr. Kathleen Geist. I'm the immediate past president of the American Physical Therapy Association of Georgia. I'm a physical therapist and have been a licensed physical therapist for the last 26 years. Currently teach and practice at Emory University. I'd like to just voice some concerns, and again, these concerns we have voiced over the last 3 to 4 years since this bill has been put forward. Our main area of concern is that changing the definition of athletic injury to condition does not align with the level of educational training of an athletic trainer, and it's a public safety concern, especially when they're talking about changing condition. It includes anybody who is physically active, which essentially equates to anybody who has movement, who can move, can be treated by an athletic trainer. And that does not take into consideration patients with end-stage renal disease, heart disease, cardiovascular insufficiency, peripheral neuropathy. We don't see where in their educational standards they have this background to treat people with a knee injury that have advanced stages of renal disease. When you think about athletic trainers, they treat mostly people who are healthy. We don't have any issue with them treating the military and being in employment atmospheres. These people are very physically active, but they do not have substantial comorbid conditions that you need to consider when you're treating patients. Changing the wording in the current bill as written would drastically change what athletic trainers can do under their current practice. And our concern is that there's really no consensus what the operational definition of condition is. And if there's not clear, concise operational definition of the makers of this bill bringing it forward, how are physicians, upcoming student athletic trainers, current athletic trainers, how are they going to know the clarity of what a condition is? I think there's just a large margin for error in that interpretation. We've asked for clarification as to what conditions they want to treat over the last 3 years and still have not been at the table to talk about language. We have sent over language from various states from across the country that have language that is consistent with kind of what is being asked. I would like to draw your attention to the Alabama statute. The current Alabama statute does say athletic injury is an injury or condition sustained as a result of or limiting the preparation for or participation in any exercise, sport, game, recreational activity, or any other activity that requires a level of strength, endurance, and flexibility. So where it's redacted in the current bill, for this bill, is still in the Alabama statute for athletic training and what they can do. And again, this is not a turf battle. This is not a financial battle. This is public safety and clarity in the language. So we have asked for clarification for what condition means. Treating an individual with range of motion restrictions that has heart failure or lower extremity deficits as a result of spinal cord injury require additional knowledge of pathophysiology that is not in the current Katie standards for an athletic trainer, and it's not provided in their formal education. So again, without having additional language to define what the word condition entails, we are opposed. This legislation is written for the potential threat to public safety and confusion it would cause.
What's it take to be licensed as a physical therapist? What type of training and education?
So a licensed physical therapist has to have a four-year bachelor's degree, and they undergo a 3-year doctor of physical therapy training. That includes clinical education and 3 years of didactic training.
And do we have institutions in the state of Georgia that offer that doctoral program in physical therapy?
We do. There are approximately 7 to 8 doctor of physical therapy programs in the state of Georgia.
So just one more year of training than an athletic trainer.
One more year of training. However, physical therapists have autonomy. We can see and treat and evaluate without a physician's referral. To my knowledge, athletic trainers are still required to see patients under a direct supervision of a physician.
So theirs is maybe a little more intense training than yours. You don't have to be under a physician.
We do not have to be under a physician's, line of sight, or we don't have to have a referral to treat our
Are
patients.
you familiar with any, like nightmare stories, horror stories, the public's complaining where they've been harmed by the treatment of an athletic trainer?
Not to date.
So, I mean, that's your concern. Your only real concern about this bill is protecting the public from mistreatment or a poor treatment by an athletic trainer.
My main concern is that if you strike kind of some of the context in which they treat, again, if they're treating healthy patients in environmental, military, police, that's fine. But where is the line when you're thinking about treating a patient who fell down the stairs, twisted their knee, and they've got end-stage renal failure? That treatment and thought process with the plan of care is much different than if you're treating somebody who's otherwise healthy with no comorbid conditions. That's our concern.
Do you know if the charges paid for your services by your typical health insurance differ from what they pay for a physical athletic trainer?
I'm not aware of any billing differences.
Senator Lucas, you got a question? You look like you're on the edge of your seat over there. You're recognized if you do. And your
Mr.
wisdom,
Chairman,
as always.
Let me ask you
Right.
something. It seems to be, it's about money. It's what you can treat. At first, I was looking at, these guys come out and say they're a trainer and come to your house and tell you about exercising and a tread machine, bicycle, and all those. That's what I first thought about. But we're talking about a physical therapist, basically, that you go and see after you have surgery or what have you. And a trainer that deals with athletes that are in competition either on the basketball court or tennis court or football field. And you say that one is under the physician's care. If you go to school to be a certified trainer, you had to be under physician in order to do it. Now you're treating all these other ailments. So are we going to define in law the difference between a physical therapist and what they can treat and a trainer?
You asking me or the witness? You're looking at me, but
I'm asking you.
I ain't the judge, I'm the chairman. Ms. Geis, do you have
I'm
an
happy to
this
answer
question?
that. I can wholeheartedly say, from a PT Association perspective, this is not financially motivated, 100%. Our concern is that if you've got patients with substantial comorbid conditions, end-stage renal failure, heart failure, the current educational didactic curriculum and athletic training curriculum does not include pathophysiology of these conditions. You have to be aware of these conditions in order to treat a patient safely from a physical mobility perspective. There are all these different things to consider for the safety of the patient. So if you push a patient with cardiovascular disease and a recent MI too far, they could have another MI if you're not aware of those types of conditions and what types of things you need to be looking for and monitoring. That's the concern.
So the language, read to me the language you are concerned about in this bill.
I don't have the language in front of me, but essentially, thank you. I appreciate that. So I think there could be a place to negotiate. Again, and I appreciate them striking exercise, sports, games, or recreational activities, but we need to talk about some type of like a healthy individual, minimizing comorbid conditions. I think if the striking, so a lot of the Alabama statute talks about athletic injury means any injury or condition, but they still have in exercises, sports, games, recreational, and I would even say employment. We could do employment activities, because when you think about retraining military, retraining professional police officers, I think we could add to the list. But again, I think striking injury and essentially striking those things that, essentially if you have movement, you could be treated by an athletic trainer.
The question,
That's my problem.
the question I'm asking you, what language are you talking about that would go in this bill that will separate the two of you?
So I don't think necessarily the goal is to separate us, because we do treat a lot of things very similarly. I think we just want to make sure that an athletic trainer can treat someone with an athletic injury and conditions related to a healthy individual participating in activities, employment activities. So I think there's ways to negotiate. I don't think we'll be able to solve this right here in this moment, but I think if we're talking about healthy individuals and getting them back to participation, and I think and ultimately that's kind of their training and education.
Senator Brass, you're recognized for a question.
Thank you, Mr. Chairman. I want to go back, we're hung up on this change in injury to condition. So how would you define injury?
So injury, if you think about athletic injury or injury is any type of damage to muscle, skin, muscle, tendon, bone, those types of things is an injury.
Okay, and you couldn't apply that same definition of condition? Because the problem I have is we're defining athletic injury with the word injury. So how does that, so I don't see how changing that one word is a big deal.
Well, I think our concern with a condition can be thought of as a dysfunction or disease process of any collection of organ systems. If you think about a condition like spinal cord injury, is a condition. There's neurological damage to the spinal cord, which, again, that you have to have that level of training to be able to treat.
Would the doctor not know that, though?
Well, again, that's going to be under the purview of the doctor's license, but I think there could be some room for misconstrued definitions of condition.
Can you show me where that would be? Because I don't see that
and likewise,
in this bill.
with condition, a child who's 10 years old who has neurodevelopmental delay, that is a condition.
Well, but the doctor, if I had one of those conditions or my child had one of those conditions,
Right.
I'm going to go to the doctor before I go to a physical therapist.
Sure. So, but I also think there, again, we have to, for the people who are coming up in athletic training, we need to have that operationally defined, like what a condition is and what educational standards set this professional up to be able to treat people with these conditions.
Well, wouldn't it make sense, though, if we're going to be talking about conditions of that severity, then shouldn't they have to go to a doctor before they come see y'all?
No. We
Why
have
not?
that. We have that training. We have we have semesters of pediatrics, we have semesters of neurologic physical therapy. We've got 3 years of that training.
All in that one extra year that y'all got from them? Mm-hmm. That's a lot
Yeah.
of stuff in 1 year.
We have 144 credits that
Okay.
our students graduate with.
Okay, thank you.
Any other questions? Do you have similar concerns about the chiropractors treating people for conditions? Are they allowed to?
Well, they treat individuals with musculoskeletal, mainly musculoskeletal complaints. We don't see chiropractors necessarily treating people with spinal cord injuries. This is mainly orthopedic-related musculoskeletal injuries and kind of low back issues.
All right, well, thank you. I'm saying that because Aubrey Valines is my next speaker. Georgia Chiropractic Association.
Thank you, Mr. Chairman, members of the committee. I'm Aubrey Valines. I'm the General Counsel for the Georgia Chiropractic Association, and we see this a little bit different than the advocates, and if you in your wisdom decide to pass it, that's going to be fine, but I want to explain some things that we disagree with, and I want to focus primarily on line 12 and 13. If you look at line 12 there, it strikes the word injury and puts in the word condition, but it doesn't define condition. I've got a definition coming up that will help an amendment. It doesn't define a condition. When I think of an injury, I think of when I broke my leg playing basketball, and broke my arm playing football, and busted my nose boxing. This wart that just popped up on my face, that's a condition. It didn't come from an injury. When I get a cold, that's a condition, a heart condition. That we all know what conditions are. But you haven't defined it. So what you've done is, as the chair alluded to, you have broadened, and what do you want to call that, an increase the scope or whatever, you have broadened what they can do. And you broaden it to conditions where right now you have on line 13 what we call words of limitation. Only during exercise, sports, games, or recreational activities. They can only treat these injuries or conditions during those things. You've struck those. And so now you go down to line 14, physical strength, agility, flexibility, range of motion, speed, or stamina. I did all those things moving from that chair to this podium. Those are not words of limitation whatsoever. If you look at, everyone's been talking about direction and supervision, that only exists for the students. If you look at line 20 on page 2, this is by the advice and consent of a physician. I advised my daughter this morning that she can go home with Molly, and I consented to that. But I'm not there right now to supervise and direct her. I will be soon, but I'm not there. There's a big difference between advice and consent and supervise and direction. Now, what I would suggest, if first of all, condition needs to be defined. If you want to define it, then what you should do, in my opinion, is on line 12, on page 1, inserting after the word condition, and I do have that typed out, the following: arising from a sports or recreational injury. You've kept in condition, but you're saying that condition has words of limitation, which is what their words of limitation are now, sports and recreational activity. And I'll be happy to answer any questions that I can possibly answer, and I'll be, Mr. Chair, can I circulate this amendment by any chance?
No, not right now.
Okay, yes, sir. Well, I have it here if it's needed.
Well, while we're on that, let's review the committee's policy on that. Authors of a bill can't come present a committee substitute on their own. Anybody that suggests or propose one, it needs to be presented to me at least 24 hours in advance. The reason for that's not that I'm a dictator, it's that it's only fair to the public to know what's being considered by the committee. And we will put those out when we put our agenda. We say whether or not it's a committee sub. If it is one, there's a stack of them on Page's desk in 432.
Yes, sir.
I have no problem with the committee considering amendments, and what you're proposing is simpler than a committee sub, but we also want to see proposed amendments in advance.
Yes, sir.
So that we can circulate them and they can be discussed and whatnot. So I don't want to slow this down, but I'm willing to slow this down for us to come out with a good policy decision. But just so everybody on every bill knows that's the way we're going to play it in here. And you also need to know, if you got something you want us to consider for a sub, you better get it in quick, because we don't have many meetings left at all. I got a couple of questions, and there may be one other. Do you have similar concerns that the physical therapists do about the competency of athletic trainers to treat these injuries and conditions?
we don't question their competency. What we question is at some point the legislature decided to put words of limitation, restricting it to an athletic setting, and now you're striking out that setting with no words of limitation and no definition of condition. I'm sure they're very competent folks. You're the ones who decide if you want to expand in two areas. One, what they can treat, and second, settings, meaning they can now do, if you change settings, that's slip and falls, that's vehicle accidents, that's workers' comp accidents, that's intentional torts. They can't do that now.
I thought the settings here are the training settings.
The training, the settings have to be participation in exercise, sports, games, or recreational activities on line 13.
So where's that got to do with car wrecks?
Well, that's not included in that. That's what I mean. That would expand that into allowing them to do that.
I don't read it that way. It says, as a result of each person's participation in activities requiring physical strength, agility, flexibility, range of motion, speed, or stamina. I don't see where any of those things got to do with riding in a car. Maybe if you're the race driver, Formula One.
I think if they were a race driver, that would be a recreational sports activity they could do. But you're striking those words on line 13 that limit what they can do, and putting in down here leaving the physical strength, agility, which is just about anything. As I said, me walking from that chair up here required all those things they listed there.
Any financial benefit to chiropractors?
Yes, sir.
What is that?
I
Y'all
mean,
get paid more than a
I think
trainer?
anytime you have a turf, and I'm not going to get up, I've been up here long enough, I'm not going to lie to anybody.
Thank you.
Anytime you have a turf or a scope fight, there's always a factor that's financial of someone's area. I'm not saying that's the predominant part, but I think there's always a factor with your competition that is money.
Do do chiropractors charge more for the same treatment that a athletic trainer does?
That I don't know, Mr. Chair.
All right, I mean, this is evolving into a scope of practice issue.
It always
Usually,
has
as
been.
The Wise Senator from Macon says, a lot of time that gets back to the money, but I'm sitting here thinking about, from a patient standpoint, if their doctor tells them they can either go to physical therapy, an athletic trainer, or a chiropractor, why don't we let them choose? Unless y'all give me a compelling reason why they shouldn't, because the way I'm reading this testimony is any of you people, well, maybe not chiropractors, but either a therapist or a athletic trainer have to be recommended or referred to them by a physician. Am I right or wrong on that? Am I missing anything? Okay. But I can go to a chiropractor just if my back hurts and I want to. I don't have to have a doctor give me a slip to let me go to see you.
We're independent practitioners, yes, sir, that's true.
Any committee members have any questions? We got one more speaker we're going to try to get to. This is going a little longer than we anticipated, but it's educational.
Thank you, Mr. Chairman.
Thank you, Aubrey. Appreciate you being here. Craig Knowles. Nope, wrong committee. Tom Bauer. Nope, that's wrong too. Grant Minix. And who wants to talk about this bill? Grant Minix, come on up.
Mr. Chairman, you did
one of my
call
own?
my name, and this is the bill that I was.
All right, Tom, you're next, then Grant.
Thank you.
jumped
I'm Tom
quick enough
Bauer
to
with
get
the Occupational Therapy Association, and I'm going to try to bring up a couple of points that haven't been brought up, but I have to echo what Senator Summers said. If I don't see how it's clarifying to change something if there hadn't been a problem, since Representative LaHood, who I greatly respect and have worked with a lot of senior issues, if we're doing it anyway, doing it now, I don't see why it needs to be changed. Couple of points to Senator Brass. I did a little bit of research on condition and injury, and condition is used interchangeably with disease or illness, and injury is usually talked about as a specific harm as a result of a specific incident or accident. The other thing I wanted to point out is I don't think there's as much physician involvement as all the time is being referred to here. And I think if you kept the scope the way it was, and this is a scope of practice bill, because as Mr. Devine said, if you take out the limiting language of the athletic activities, the other physical activity is really not very limiting. I would probably agree with you, Mr. Chairman, that a car wreck probably would be stretching it. But very frequently, an athletic trainer is going to be on the field or in practice or somewhere with the person who's been injured, and if the physician's not there, and if you pass this bill, then you're saying that the athletic trainer can work on certain conditions, such as the heart attack, cardiology. So I think without some limiting language, and I understand your policy about amendments, and it's certainly well-founded, but I think without limiting it somehow, your condition's very vague, and you're allowing something to be treated without the doctor necessarily being there, and as Dr. Guy said, it's not necessarily within the training. Representative LaHood has said this is a clarifying bill, and I would submit to you that this much discussion indicates it's really not clarifying. The bill passed just by 2 votes to spare in the House, so I really don't. I don't see a compelling need to change the scope of practice. I don't see why you need it to better regulate the public, especially if things have been going on as they have been.
Do you have a proposed amendment? Did you have one, Aubrey?
I had one that I had sort of floated with some
Have
other
y'all
folks.
shown it to Representative LaHood?
I showed him one last year, but quite frankly, we haven't had any indication that there was any willingness to look at it.
It's not a friendly amendment.
Correct.
Okay. Have you shopped it around committee members to see if anybody wants to propose it?
I have not.
Okay. All righty. Questions for Mr. Bauer? Senator Ginn, you look ready. You are recognized.
I'm not sure if my question's for Mr. Bauer or for our chairman, but, you know, I want to help Representative LaHood get his bill passed, and I'm just wondering if we let them stew for till our next committee meeting, if they can work something out that says, okay, we got it worked, we clarified it, and here's what it is. I'm just know we spent an awful lot of time on this one, and you got a list of bills there to look at today, and I don't know if, you know, I want to help get the bill passed, but same token, I want to make sure it's in the interest of the citizens of Georgia.
Tell you what, we got one more speaker lined up, and I want to at least get through the testimony. We had a number of bills on here, but speakers only signed up for a couple of them. So let me at least finish up the testimony. Did you get to say everything on your mind?
Yes, sir. The other points I were going to make, and we'd be more than happy to work with all parties on this.
All righty. Well, Grant Minix, you finally have your chance. Come talk. I can't read who all you're with, the council of somebody.
Mr. Chairman, I'm here to testify on the interstate massage compact.
Okay.
On the riveting of this conversation.
Well, it's interesting. You put neutral on where you were for or against, so that'll be great. We'll see when we get to you on that. Okay, Senator Ginn, you raised a good point on that we do have other bills. We're pretty well through with this. I'm going to let you wrap up, Representative LaHood, and give me your thoughts on if you want to vote on this bill as is, or you think it would do you any good to continue working with any of your people that are testifying against you.
Right. So
Let's see what he says.
I'm always open. I think anybody that knows me knows I'm open to having discussions. What I find very interesting is they have not come to me. We voted this out of the House on March the 4th. Today's the 18th. That was 14 days ago, and no one has offered amendments to improve the bill. So that's one thought. And so I think they've had enough time to bring amendments if they were serious about bringing solutions.
Okay.
The physician's the gatekeeper here. And I like what you mentioned about giving patients a choice. They can already decide if they would go to a chiropractor or a physical therapist. Let them decide. If the physician blesses it, to go to an athletic trainer. Part of being a professional is knowing your limitations. And I believe an athletic trainer knows not to do brain surgery or not to treat renal failure. That's not what they're trained to do. They're trained to treat conditions related to physical activity. So
Senator Brass, you're recognized.
Should the author allow it, I am prepared to make a motion of do pass, but I'll remind him that should it fail, the bill is not dead. That would be when you could discuss the amendments.
With that reminder, what is your pleasure? I'm deferring to the sponsor, not putting my thumb on the scales one way or the other on this. It's a very lively discussion, informative. Would you like us to take a vote on your bill today? There's going to be a motion, or would you rather us table it to let it smolder for a day or two?
When's our next meeting, Mr. Chairman?
Tomorrow morning, 9 a.m.
Could this be added to that agenda?
Possibly, it'd fall to the bottom. It'd be the fourth bill on that list. But I'm happy to do
I
that.
think it helps, Mr. Chairman. I like Senator Brass's point. If we vote today, at least I get to see where people stand and know who I need to talk with to work on solutions.
Senator Alberts, did you have a comment or a question?
I do, Mr.
You're
Chairman,
recognized.
thank you. Representative Hood, I feel your frustration, and to the folks that are here that brought amendments, why didn't you talk to the author? You all been doing this too long not to give him the respect that he deserves and coming and meeting with him ahead of time. So for that part, I certainly understand. I do scratch my head in a couple of things, candidly, on lines 53, or I guess starting on 52 down, of why that's there. And one of the things that I have seen in my 15 years is a lot of times people are in a specific industry try to continue to get everything down so nobody else can come in, and it becomes protectionism. And I hear what you're saying, and I trust you, and plus the way I've seen you pass a lot of great legislation down here. The question keeps running through my mind: if this doesn't pass, will anything really change? And that's I'm trying to get there. I just haven't mentally gotten there, just to let you know.
What are your druthers? What are
Excuse
your
me?
druthers? Leave it up to the pleasure of the committee?
Let's take a vote.
All right, there's a motion do pass from Senator Brass. Is there a second? That's not a good sign right there. All right, well, is there a, Mr. Vice Chair, is there a motion to table?
I make a motion to table this bill, Mr. Chairman.
Is there a second to that? And there's a second to that. I'm sorry, Senator Rhett, did you have a question?
No, I was just gonna say, I'd like to see you and the other people who were late, just have a discussion. And that way, if it's on the table, we could bring it back tomorrow morning. Because I don't want you to have a vote and,
We're good.
And I understand your frustration. You passed this bill since the 4th, and now all of a sudden,
All right. Any further discussion on the motion to table? All right, all in favor, raise your hand. Got one. This is whether or not to table this bill for the time being. Let's see here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and all opposed? We got 2 opposed. All right. Thank you. Wonderful presentation. We understand the issue now. You work with whoever you want to. And if you would come back to me when you feel like this is ready for action. I'm going to remind you and everybody in the room, we got a meeting tomorrow morning at 9 a.m. We got a meeting Thursday afternoon, was that 3 or 4? 3 o'clock Thursday afternoon, which is probably just a 1-hour slot. We're supposed to have 2 hours a day, but we got talking about Donald Trump for a few hours on the floor.
Well, I appreciate your time today. I know this took up a lot of time.
And we're going to be meeting next Tuesday and hopefully next Wednesday and Thursday, but those are way more iffy because of the way the calendars have been working as we hear more and more bills. All right, let's move on to number 2. Thank you.
Thank you. Thanks for all your time
Appreciate you
today.
being with us today. I know I got some folks on this committee that are not going to be able to stick it out the whole way. If you got to leave, you got to leave. We got enough. Representative Reeves, House Bill 579, you have assured me is a 5-minute bill. You got 2 minutes to present. No, I'm teasing you. You take as long as you need.
Good afternoon, Chairman Cowser and members of the Regulated Industries Committee. I present to you House Bill 579. This is the product of the joint Senate-House Blue Ribbon Professional Licensing Act. So I know a number of you worked on that during the 4 meetings that the joint blue ribbon panel had last year in 2024, but also I know how much time this committee puts in on professional licensing and constituent services relating to professional licensing. So what this bill does, by the way, this is the House version that passed the House, LC 550580S. What this does is it delivers to the people of Georgia what they deserve, which is excellence in customer service on professional licensing for the sake of our workforce, for the sake of our small businesses, and hardworking Georgians. Barbers, nurses, funeral directors, on and on and on are licensees in Georgia. We have hundreds of thousands of licensees, and what this does is it allows more instances where if it's something that should be rubber stamped, there's administrative issuance of licenses. What it does is it removes transcript hurdles. It provides for cooperation with the technical colleges and the Board of Regents with getting the transcripts without there being a bunch of red tape on that. And it frees up the appointed board resources for bad actors and for policy and not dealing with licensing decisions and having to wait 6 months to get your license because the board doesn't meet until then. So I can go through the bill in detail, but it has been it is the product of a lot of work by a lot of senators, and we appreciate the time that was put into this. It passed overwhelmingly in the House, and respectfully request your approval of House Bill 579.
Is this the one that's supposed to cut the red tape?
Absolutely, absolutely.
Questions? Senator Brass, you're recognized for a question.
At the appropriate time, Mr.
All right. Anybody got questions? All right, you hang tight right there, Representative Reeves. I think I got Tim Davis. Tim, Georgia Nursing Association, you wrote down House Bill 59, or either you misspelled 54. This is 579. Is this the one you want to talk about? 54. All right. Is there anybody that wants to be heard on House Bill 579? All right, it is the appropriate time. Senator Brass, you're recognized for a motion.
Mr. Chairman, I make a motion do pass.
Is there a second by Senator Sims? You get to so many of them, Senator Albers, I'm going to give her a chance. Any further discussion?
Senator
My
second.
eager beaver. All right, any discussion? All in favor, raise your hand. It appears to be unanimous. Thank you. That's
Thanks so much.
well presented.
Yeah.
And Senator Larry Walker said he would carry it in the Senate, and look forward to seeing your Rules Committee. Thank you.
All right, let's knock out another bill or two here if we can. Now, House Bill 54, Representative Clark, you still with me? All right, you do have a couple people signed up, so we'll go ahead and get yours done with the little testimony. Mr. Vice Chairman, you need to go. You free? We got it. Yep. Fire away. Tell us about your bill.
Appreciate it, Chairman and committee members. I have House Bill 54. Try to keep it short. It's been a long day. Back in 2020, Congress passed legislation allowing PAs to sign home health services for patients, assuming that states authorize it. So this bill would just allow PAs to sign home health services. I'll say Georgia's ranked 7th among states that older adults are moving to, and so home health services are a huge part of, if somebody is in the hospital, is getting help, and then they're able to go home, it really cuts on costs a lot if they go and have home health services. So this is just allowing PAs to have the authorization to sign those, and it passed unanimous through committee in the House chamber, and see what anything else. The medically trained, licensed to provide high-quality care, treat illnesses, plan prevention strategies, and write prescriptions. And there's 4,000 PAs, and this just allows them to be a part of the process to help expand healthcare, and especially in like rural Georgia and all that. We know we have a need out there. So
Okay.
we're glad to take any questions. It's a real simple bill, just allowing the PAs.
This was kind of what I had in mind when I set the agenda today with 6 bills. I thought they were rather straightforward, but you do have a couple people signed up. Tim Davis, would you like to be heard on this bill? Georgia Nursing Association.
Yes, sir. Thank you, Chair. My name is Tim Davis. I'm the Director of Government Affairs for the Georgia Nurses Association. We very much support this legislation and would ask for your favorable consideration. We would also respectfully request that the committee consider adding the language from House Bill 298, LC 46-1200S. It's a shared governance nursing staffing bill that passed out of committee but wasn't able to be heard by the full House before crossover to this piece of legislation as well.
Okay. Any questions? All right, I'm going to have one other speaker, and then we'll get back to your proposed amendment. Sheila Humberstone. I'll give the committee a little background that several groups have come and presented a proposed amendment that did allow that amendment. Representative Clark, I hadn't had a chance to speak with you about it. Have they talked with you about that, and do you have a problem with that?
No, I don't. I mean, if the committee wants to.
Okay, 298. Ms. Humberstone, if you would please give us your thoughts on this bill, and if you think it could be improved by that addition, and please explain that to us fully, what it would be.
Yes,
We're not
sir.
going to vote on that today without the committee having seen it.
Yes,
But I
sir.
want you to explain it at testimony day. You have provided it to me,
Yes, sir.
but I'm not putting it in a committee sub. It would be an amendment, I think, unless you've got one ready.
Yes, sir.
All right.
I'm aware of the rules of the
Okay.
committee and respect the
Tell us what
process.
you're trying to do. It made some sense to me, and it doesn't appear to have any opposition from the author, but you need to explain it to us.
Yes, sir. Mr. Chairman, members of the committee, my name is Sheila Humberstone with Stonebridge Consulting, here today in front of you on behalf of the Georgia Association of Physician Assistants, obviously representing the physician assistants here in Georgia. I want to commend the author for bringing the bill. I think it's incredibly timely, as he alluded to the fact that Congress allowed during the COVID emergencies physician assistants to order, which is sort of their word for prescribe, home health services. That has been extended so long as the states also ratify that or support that. So this bill is just making the attempt to do so. PAs are what I would like to call physician extenders in the community, and they enable our constituents to see more patients more timely and just better take care of their patients in a team approach. Physician assistants are licensed by the Composite Board of Medical, and so we share that licensing board, and our job descriptions are actually approved by that same board. So I've been in front of you, I think, in the last couple of years on similar pieces of legislation, and would just remind you that we are in fact licensed by the Composite Board. We do support, the physician assistants do support our nursing partners in this effort to work on nurse staffing. We watch that bill not make it over, and I think it's a great vehicle for making sure that nurses have a seat at the table in terms of staffing issues. I think at least everything that I've been told is any controversy around that issue has been worked out, and I think everybody is comfortable with it. I would say that I would propose a friendly amendment, and I did talk to the sponsor about it and a couple of you, that I think that the bill is drafted makes a lot of changes in Title 31 and 16 and in various places where we've changed physician to physician or physician assistant as authorized by the supervising physician to do things, but we didn't go into Title 43 and specifically say a physician assistant may order home health, and I do have a relatively simple one-sentence line that I would respectfully ask to be added into the bill if we're going to make additional changes. I can get with legislative counsel, but I can read that aloud or work with you between now and tomorrow morning.
Any
Yes, sir.
questions by committee members? All right.
Appreciate your favorable consideration.
Representative Clark, let me tell you what I'd propose that we do. I'd like you to sit down and review the language that's been prepared by these folks and to make sure you're okay with it. And Ms. Humberstone, if you will get with Nick and show him your one-sentence change.
Yes, sir.
Nick, do you have time to get this together sometime tomorrow? All right. What we're going to do is we're going to put you back on the agenda Thursday afternoon. You're going to be first up unless somebody else doesn't get up, and it will be a committee substitute. And I want you to be able to agree that it's good, and I'll try to walk it through too to just show what the differences are. This sounds so benign to me. The only question I have is, why didn't this get through the House? You said it didn't make it through the House. How come?
You want me to-
They had a whole bunch of other stuff flew through there.
Yeah, thank you again for the consideration. We worked on this legislation, I think, for a period of about 3 years now. We take great care to make sure that all parties that have a vested interest in it and could potentially be impacted by it, that we secure their buy-in, and I think we've arrived at that place now. Unfortunately, in close to the 11th hour last week, we did have an issue that was raised that, in our opinion, was not germane to the spirit of the bill, which is, giving nurses a seat at the table in staffing discussions. But we were able to negotiate a reconciliation of that issue.
Okay.
And that reconciliation is included in the version that I mentioned before.
When you say seat at the table, what are you talking about? What table?
So essentially,
licensing or treatment of patients, or what?
so essentially, it's about staffing levels in the individual hospital units. We don't take away the power of hospitals to be able to be the ultimate decider in whether or not they're in the decisions that set the levels. But really, what it does is it creates a nurse services staffing plan that would, or a nurse services staffing committee that would include bedside nurses, actual bedside nurses who spend at least 75% of their time providing direct patient care, and then it would give them a seat at that table to say, hey, this is what we're needing on the front line, this is what we're seeing on the front line.
Make your suggestions to hospital administration before they set staffing.
Right, exactly.
Gotcha. Okay, thank you. Be ready to be back here Thursday if needed.
Will do.
Representative, thank you so much.
Chairman,
Yeah.
are you
Yeah.
putting this together, or do you want me to do that with?
I am going to do that, but I want you to look at what they're presenting, and I want your sign off on it. I don't want them to kill your bill here on something that they couldn't get out of the house and waited till the 11th hour to work out the problem.
I appreciate that, and I'll make sure to follow up
And
and make
that's
sure all
just out of
sides are good.
respect for you, and it's to your process. We can deal with that one later. But on the other hand, it sounds so benign. If you're cool with it and they got the language and Nick can do that, we'll put together that sub tomorrow after you've approved it, and we'll have it here ready to go on Thursday afternoon, and I will have it in my office on Wednesday afternoon for anybody in the United States of America who wants to come look at before we get here. Okay? Next bill, if y'all will be patient, we can knock out a couple really quick. Representative Washburn, yours is going to take a little bit longer. You got to be patient with me. We're going to put you on for tomorrow morning, okay? Because Deborah Silcox is going to jump you, but I'm going to call Jenny Earhart first. This is a dietitian bill. If it's what I think, we passed this last year.
Yes, you did.
You can tell us if there's a change, but I think it's so clean, it just didn't get called up last year, right or wrong?
That is absolutely
Okay.
correct,
Tell us
Mr.
what it
Chairman.
is. Something
Yes,
about
and thank you so
dietitians.
much, and members of the committee. I just want to thank you. You know, I serve on the House side, the Regulated Industries Committee, so I am certainly no stranger to licensing bills, and I want to thank the chairman for his comments at the opening of the meeting, where he expressed concern over the just the plethora of licenses we have in this state, and the concern about broadening of scope, which is why I'm particularly delighted to bring you a bill that does just the opposite. It narrowly defines, it streamlines the process for licensing dietitians and nutritionists in the state of Georgia. Why is it important that we do this now? Well, nothing has changed since I presented this bill originally, and that is the fact that the Georgia Dietitians Practice Act has not been updated in more than 30 years. It's an evolving field, the field of nutrition. So what are we doing? I said this to a colleague the other day. I said, this is one case where two is more than one, meaning we currently have one broad dietitian's license that creates confusion for a lot of folks. Who should be licensed as a dietitian, or who should be licensed to give nutrition advice? Should your kid's T-ball coach, because he's talking to the kids about the food pyramid, should he be licensed? Personal trainers, people that work in the GNC nutrition store, should they be licensed? There is confusion right now with the current language. So what HB 185 does is it narrowly streamlines and narrowly defines the practices of dietitians and nutritionists into two distinct licenses. And what it does is it addresses the issue of the question of what really needs to be licensed when it comes to nutrition, and it's medical nutrition therapy. What is medical nutrition therapy? It's the practice of prescribing and giving nutrition advice for the treatment of illness, conditions, and disease, not just general nutrition advice. And those who give this kind of advice have the highest level of education, and therefore we are going, that is why we think it is important that those are the individuals that are licensed. So narrow licensure requirements focusing on the practice of medical nutrition therapy. That way we ensure that only those with the highest level of training manage complex nutrition-related conditions. That, in a nutshell, is the meat of House Bill 185. I would also mention that since last time, we have added compact language, and I know that, Mr. Chairman, you addressed that also in your opening comments. I would like to say that the compact does not currently exist. This would permit Georgia to join a newly formed compact. There is an advantage to being one of the first 7 states in any compact because it would give Georgia a seat at the table for setting those parameters and requirements for the compact. So we believe that's a very positive move in the right direction.
Okay. Is that the only change in this bill from last year's version?
We had a couple of requests for a carve-out for the WIC program. So that came directly from the Department of Public Health, and we made that change. There was one other. I'm so sorry. Let me introduce Robin Stegall. She's with the Georgia Academy of Nutrition and Dietetics. I lean into her on some of the more complex
We'll call on
issues.
her in just a minute. She'll
Okay.
be next. But for you first, do you know of any other changes other than that WIC and the compact?
Yes, thank you. There is one other. We discovered over on the House side, after it had passed out of committee, that there was some outdated language as it relates to fingerprints.
Okay.
And so that was not current, and we made that update.
The reason I'm asking you is because we passed your bill last year out of this committee. I believe it was unanimous, and the esteemed Rules Chairman put you on the consideration calendar, and you were on the Rules calendar last year, but it got tabled, if I recall that right, and didn't get called up for a vote. So you've been a long way. Maybe it didn't make it that far. All right. Well, maybe he'll get convinced this go round. All right.
I will
Well,
yield for any questions.
You're not signed up to speak, but you're welcome to speak since you're the subject matter expert. Introduce yourself and tell us what you know about this subject.
So my name is Robin Stegall, and I'm a registered dietitian and a licensed dietitian. I'm in private practice here in Georgia. I've been in private practice working up in Roswell for the past 16 years. I also represent the Georgia Academy of Nutrition and Dietetics, and I've been a volunteer with them working in government affairs for the past 8 years. We began a process of deeply examining our licensure statute. That process began 3 years ago, and we have worked in that 3-year period of time with, the national agency, the allied health professionals, and folks that are interested in prevention and wellness services to create a licensure statute or a licensure bill that essentially retains the essential element of protecting the public by requiring a license for the delivery of medical nutrition therapy, which is that highest level of nutrition care for a diagnosed medical condition such as diabetes or cancer or heart disease, but then expanding the exemptions and allowing for greater clarification around that prevention and wellness treatment. So folks that are wanting to, provide, lessons and information on how to create healthy meals for their families, or certainly coaches that are trying to help their athletes get ready for games and things like that, that we've provided some clarification and guidance that those are the kinds of things that would not require a license.
So right now, dietitians are licensed,
That is correct.
and that's the Georgia Board of Examiners of Licensed Dietitians that's in charge of this group?
Yes.
Well, why y'all want to be in a compact when you are the only person at the table right now? You can set whatever rules you want to. Why do you want to have a say at a bigger table once, and not even knowing who else is going to be at it right now?
So, well,
Go ahead, Robin. Yep.
So if I may speak to that. So the interest for the dietitians in Georgia, particularly for dietitians that are working with companies that are providing telehealth services, those dietitians currently would need to get an individual license and every state where their patients reside. I've had dietitians that come up to me to say that the burden and the time-consuming process required for that, this is thousands and thousands of dollars that is required, and it takes them a very long time, and then licenses are expiring that are non-concordant. So it makes it very, very hard to service and care for folks in that way.
Out of state. So you want Georgia dietitians to be able to telehealth across the state lines and, I presume, charge for those services?
Well, exactly, and we certainly have dietitians that are working in our border states, border cities such as Augusta, and they're seeing patients from South Carolina, and it's requiring them to maintain licenses in different states. What we're hoping to do is be one of those first 7 states so that we, as our licensure board here in Georgia, is able to establish what the requirements are for that compact and what the level of training and level of skill is required to be licensed in those states or to join that compact. And then it's not required for dietitians to join a compact. If they want to stay, with a single state license, they certainly can do that.
Okay. Thank you. Any questions? Senator Rhett, you're recognized for a question.
Thank you, Mr. Chairman. Does this include diets such as the senator from the 26, Luke's Lounge, fried chicken, peanuts, potato chips, cold one?
I'm not sure what medical nutrition therapists would have to say about that, but I'm a fan of all the things you just mentioned. Mr. Chairman, if I may, I would like to also, again, I'm a big fan of legislation as relates to licensure that heads us in the right direction towards making it easier for people to operate in the state of Georgia. Being the #1 state in the nation for business, we want to make sure we don't put any blockades in that way. I do know that I had an opportunity to talk with Robin about what do you think this bill will do to the anticipated number of licenses that are issued. Will it go up? Will it go down? And best projections are here, because we are so narrowly defining now and reserving licensure only for medical nutrition therapists, where the greatest level of harm is potential, therefore the greatest level of training is required. The anticipation is that the number of licenses in the state will go down.
Okay. One thing you shared with me that I think this committee ought to know is that we're not talking about a school lunchroom who's putting together the menus. This is medical dietitians treating medical conditions, diabetes, et cetera,
Yes.
that type of thing.
Yes, and these individuals to be licensed have to have a bachelor's, a master's, and 1,000 hours. I'm sorry, Robin, help me
Yes.
with 1,000 hours.
Okay.
Yeah.
1,000 hours of supervised practice, and then pass a national exam. So for folks that have babies in the NICU or family and loved ones in the ICU, these are the patients that are receiving medical nutrition therapy, and this is where we feel like a license is essential.
All right. What's the pleasure of the committee? Got a motion to pass by Senator Jones, and it's second by Senator Brass. Quick on the draw. Any discussion? Proposed amendments? All right, all in favor, raise your hand. Any opposed? It passes unanimously. Thank you, and
Thank you, Mr.
appreciate you
Chairman.
explaining that to us.
Thank you
Y'all
so
need
much.
to rename this. You ought to call it
Suggest-
medical nutritionist or something. That's what they're doing. It's not. I mean, a dietitian sounds like somebody can teach me how to lose weight.
I
or
agree.
something, you know what I mean?
I couldn't agree
But anyway,
more. We
proud
like your
for you, happy
suggestion.
for you. Maybe next year we'll change the name.
Thank you.
Thank you.
I'm gonna hear one. Oh, yeah, who's gonna carry that bill for you in the Senate?
It looks like Senator Walker.
All right, Larry Walker, the licensing expert. He's got it. Representative Silcox, I got time for yours, I think, and then we're gonna, Representative Washburn, while I have you, you don't have to sit here unless you're just as intrigued by all this as the rest of us. But one reason I'm holding you is because the governor's office had suggested a committee sub that they were gonna meet with you and see if that was acceptable. Have you met with them?
Spoken to them by phone.
Okay, I have a copy of that, and I will have it available for you to look at, and heck, I might have it now, but I'll give it to you and let you review, because they made it very clear they do not want to hijack your bill, would only go forward with that if you agreed and I agreed. If you do, we're going to have it available in the morning. But let's discuss that offline and before we put you back on. You'll probably be on tomorrow or Thursday. What would suit you best? 9 a.m. tomorrow or 3 p.m. Thursday? You can let me know later if you want to. Okay.
Thank you.
All right.
I've got a real early subcommittee.
I think I'm going to just put you on Thursday to give us time. I'm going to put you on Thursday.
That'll be fine.
Okay.
Thank you, Mr. Chairman.
All right. Representative Silcox, House Bill 232, fire away.
Thank you, Mr. Chairman. And just to address some of your comments, I will say this is a compact for massage therapists. And just as you stated earlier in the meeting, this is partially to help military families that are moving into Georgia. If they are already licensed, they would be able to come in and not have to have that licensing burden to be able to go ahead and practice massage therapy. I will tell you, I will bring your attention to line 248. It's page 11 of the bill. Just so you know that this says specifically that nothing will restrict the ability of a member state to enforce laws, regulations, or other rules related to the practice of massage therapy. So this is not going to restrict the state of Georgia's ability to regulate massage therapy. And I just wanted to mention that because it sounded like it was a concern of yours. On the previous page, it does give the requirements for practicing massage therapy, starting at line 206. And I will point out that there is a change, and I believe we provided the amendment for you in advance on the 625 hours.
That's a bill we already heard in here earlier
Correct.
this year that increased the amount of training.
Correct.
It's just changing that one line, putting in here.
Yes,
If you're
sir.
okay with that.
And that
We've already
does-
passed it. I have no problem with that.
That's
being-
terrific. And that is to put us in line with our other surrounding states. So we would be consistent in the southeast with that.
We have that in our folders, and I think my vice chairman's going to tender that at the appropriate time.
But those are the only really distinguishing, interesting things. Like I said, the state of Georgia will still be able to regulate massage therapy, and then we would need to increase the hours to 625.
So I find it hard to believe there are a lot of Army wives and or husbands and Navy wives and husbands that are massage therapists, enough that we need to pass a bill for them. But what do we call y'all, squabs? Squabbies. But that doesn't mean it's not a good thing. And what I'm told by the industry is, unlike a lot of professions we're licensing, one of the reasons we license massage therapy is because of the sex trade, sex trafficking, and perhaps inappropriate massage services that are occasionally offered. This allows us to make sure that people holding themselves out as massage therapy are there for the right reasons.
No, I so appreciate you mentioning that, Mr. Chairman, and I will say that those particular instances are mentioned in lines 228 through 234, and it says specifically kidnapping, human trafficking, human smuggling, sexual battery, assault, and any related offenses. So absolutely, this does go to trying to regulate those horrible instances better. So I appreciate that.
Questions by any committee members? All right. Make sure if I got anybody signed up to speak on this one. Anybody else want to talk? I don't
Yes,
think I
these
have
two
it.
gentlemen are
I
here.
kept trying to jump you earlier. Your Grant Minix.
Yes, sir.
Okay, is this the bill you want to talk about?
Yes,
That
sir.
you're neutral on?
Yes,
Okay.
sir.
Well, tell us why you're neutral.
My name's Mr. Chairman, members of the committee. My name's Grant Minix. I'm a policy analyst with the Council of State Governments.
Oh, great. I should recognize you. Good to have you.
Glad to be here in the home of CSG South in Atlanta. So we at CSG developed all the professional licensure compacts, including the Interstate Massage Compact, in coordination with the Federation of State Massage Therapy Boards and in a cooperative agreement with the United States Department of Defense. Interstate Massage Compact works very similarly to the Nurse Licensure Compact and the Social Work Compact, which have already been enacted here in Georgia. It's along with 7 other professional licensure compacts. It works similarly in the way that it allows individuals to obtain a multi-state license, works kind of akin to your driver's license. You meet the requirements of the compact. You have a single state license. It allows you to go into each of the compact member states.
Right.
I'll note just a few highlights for the bill. I know want to be cognizant of time here, but the compact creates a shared data system which allows states, so your licensing officials here in Georgia can see instances of bad behavior or adverse actions taken against individuals in other compact member states. That keeps your licensing agency aware of any of these bad instances that can pop up.
Okay.
So you know that and can take action on that specifically.
All right.
And also, this compact takes great progress for military families as supported by the Department of Defense. So we appreciate support on that.
Representative Albers, you're recognized.
Man, I got to vote it?
You could do whatever you want to do. You want to ask a question, make a
You said
motion?
call me representative. I got
Oh,
a
I'm
little
sorry.
nervous.
Yeah, I see it. See, it's a long day.
Mr. Chairman, I'd make a motion do pass so we can add a nice amendment to this for my friend.
All right. Is
Representative
there a
Summers.
second to your motion? Second by Senator Rhett. And any proposed amendments, Senator Summers, you are recognized. This is in the folders. If you would read the number in that upper right-hand corner, we're going to call this Amendment 1.
AM 520064.
All right.
Amendment number 1, we're raising the minimum hours down from 500 to 625.
Is there a second? Second by Senator Chairman Albers. Any discussion on the amendment? We'll vote it first. All in favor, raise your hand. Oh, slow unanimous. You want to change your mind? Lower your hand?
Yeah, I do.
All right, 1, 2, 3, 4, 5, 6, 7. All right, so it's 8-1. That amendment passes. Now, we need to take action on HB 232, that's LC 520701 as amended. All in favor, raise your hand. All right, and all opposed, same sign. Thank you. Passes unanimous. Who would you like to carry that? Let me guess, Senator Walker?
Senator Still.
Oh, Sean Still,
Yes.
okay. Thank you.
Thank you so much.
All right.
Same deal.
Thank you for being here. Thank all of you for your patience today. Committee members especially, I apologize. We went much later than we intended. We are adjourned, but we'll be back at 9 a.m. Much more lively discussion tomorrow.
Brandon beat you, 8 o'clock.